There, now it's recording. There we are.
Pay attention. Pay attention.
Neurogenic bladder, we went over this too. We got this far. That's the loss of the voluntary control, avoiding. So, like, they don't have a control of it. It just happens. Sort of like urinary tract incontinence. But do you remember, this one is not caused by infection. This is the one that has those lesions and...
I think we did go over this.
Yeah, we did. We got to this part. Spina bifida, trauma on the spinal cord. That's people who will have a neurogenic bladder.
Alright.
So you can try bladder training just like you do with a toddler, but sometimes it works and sometimes it doesn't for these folks. It's just a lot of emotional. Do what?
Bladder training with a toddler, how can you let it fill up?
Yes, you let it fill up so they feel the sensation and then you let them release it. But sometimes it depends on where the spinal cord injury is. They can.
Wait. What do you mean you let in?
They have a catheter,
Oh,
and you can clamp it to where it's not draining so that their bladder stretches, so then they feel that sensation of the full bladder. Then you unclamp it, but you're doing it on like every 2 hour schedule. Sort of like potty training a toddler, except they're not peeing on the toilet, you're just clamping and unclamping the catheter. Sometimes it works for neurogenics.
So what are the causes again?
Like spina bifida, where the nerves from the spinal cord don't reach the bladder or they're not working correctly, that tell the brain when the bladder is full and needs to be avoided. Multiple sclerosis, and then trauma, spinal cord injury.
That's
It's more like the neuro. That's what neurogenic. Any kind of spinal cord neuro. And it can be spastic or flaccid. Spastic is where they just lost the urge to avoid. Flaccid is where it just the bladder fills and gets distended, but it never completely empties. Okay? All of that's in your book. You just read over neurogenic bladder.
1688.
Okay. We talked about urinary tracts, and I gave y'all a little handout with a little lady crossing her legs. E. coli is #1 cause. We know all the symptoms and things to watch for. Urgency, frequency, burning, hematuria. Give them antibiotics till they're gone, fluid, and hygiene. Talked about urethritis. That's the one that has the purulent exudate at the meatus. Treatment is to get antibiotics, and also what would be something else you would want them to do to get rid of it besides antibiotics? Treat the cause. They can't keep having sex with the same person that keeps giving them the infection. So they could, but they're going to stay infected. So you have to get their partner to come in and test them or educate them, and then use condoms. Okay. Cystitis. That's the inflammation of the wall of the bladder. We talked about that. Same symptoms as a UTI. Dysuria, urinary frequency, painful urination, peeing at night, cloudy urine. Just make sure the same measures. Increased fluids, antibiotics still gone, I know. All that good stuff. Interstitial cystitis. That's the one where the pathology is not known. They really don't know what caused it, but they think it might be linked to fibromyalgia and things like that. They're still doing a lot of studies on it. It's where the urine actually eats away the lining of the bladder and it's seeping in, so it makes their whole abdomen tender and distended and sore. Okay? Happens in young women, 30 to 40. So you can imagine the self-image and body image disturbances they have. And having to go through that because they're not able to hold their bladder sometimes. It's very uncomfortable. Can't have sex. The pain is very strong when they're having sex because it's all swollen and irritated. Okay. Prostatitis, guy's turn. The prostate is a gland that wraps around the male. Take my bladder away. The male parts of the body. So if the prostate's big and inflamed and swollen, it's pressing down on their bladder. So that's like an obstruction. They can't pee as well, or it causes them to pee too much. Or they try to pee and it just dribbles out. So they'll have fever, chills, Everybody's excited. Read your little book. That's the one that's super painful for men. They go into the urethra and they cut through their bladder so that they can get to the prostate, and they just take a little clamp and it literally just pinches and eats away at their prostate piece by piece.
For how long?
Well, that's what the surgery does. They're taking it out because it's big and swollen, so they're getting it off of the bladder.
So they're removing it, but they have to.
Piece by piece. And it's so bloody and clotty. And that's the one that has the 3-way catheter that you have to constantly irrigate. And your job as a nurse is to make sure that, one, it's irrigating and it's not clotting up and that they're not getting distended.
Are you irrigating every 2 hours?
It's constant.
Oh.
Constant irrigation.
Oh, so it's doing it
It
itself.
will wear you out. It's a bag hanging and it connects to their catheter. So all the fluid goes in, and then it's got another tube that all the bloody, clotty urine and the fluid comes out of. Strict gyno on that.
Katie's patient have that.
It's a very, we were in there all day, really, probably just busy. You have to really watch them close. So the chart, I'm sending it around, and it just kind of tells you on the little picture. They don't ever look that happy. Just kind of things to watch for.
Yeah, you know he ain't here.
They're pitiful. They're in bad pain. All right. We got the pyelonephritis. Pyelo means pain, fever, nephritis. Neph meaning kidney, and itis, inflammation. So this is where the inflammation of the structures of the kidney. So always cause that E. coli again. And the kidney itself. This is a kidney infection, not just the bladder down low. This is the kidneys, and they're in a lot of pain because they're swollen and infected, full of bacteria. They might even have little abscesses, like little nasty pus pockets on them. Okay? And they're going to come in with a high fever. We already know that. You should know. If they've got infection, they're going to have fever, cloudy urine, pus in the urine. Please spell it correctly. Mucus in their urine, blood in their urine, severe flank pain. Okay, they're hurting bad because now it's moved up just from their bladder. It's up in their back now. We want to teach the same things: fluids, antibiotics, hygiene. It can be one or both. Depends on how bad the infection is. It can be one or both kidneys. So it might be unilateral or bilateral. Depends on where the infection is. And do y'all know what azotemia is?
Yeah, it's the retention of the excessive amount of
She just rattled that right off the top of her head.
I googled it.
Azotemia. I didn't know either. I had to look that one up. Because that's not a term that I've heard very much. And so what that is, if you see that, that might be, you know how they like to throw those out at you, these random weird terms on your tests. It's elevated BUN and creatinine is basically what it is. And remember what I said about BUN and creatinine, always associate that with kidney failure, kidney problems. So they've got a buildup of that. That's the term for it, the technical term. Why would theirs be built up? They just got a kidney infection. Why is theirs built up? The kidney's just not working. It's too busy taking care of all that pus and trying to get that cleared out. So the kidney's not working, so your BUN and creatinine are elevated, okay? Does that make sense, everybody? Then we talked about obstructions and kidney. Did I have a kidney? I think I have a kidney stone picture. Oh, I do. Kidney structure obstruction, renal calculi. Highest in males over 40. Same thing. They're nauseated and vomiting. Why would they be nauseated besides the pain?
Where is this from?
It's right here in my hand. Hold up, babe. Right here. She's like, what? They have nausea because if you're not clearing all that BUN and creatinine, that's waste. That's poison to your body. If that's not getting out of your system, it's just like any poison or any medicine that's not good, you're going to get nauseated and sick and feel poisoned or drugged. So that's why they'll have nausea. So that picture's coming around. It's usually men, and like I said, they act like they are dying. They say that's the closest it is for a man to having childbirth. I don't know. I think we win on that argument, but and it tells you on there, it's kind of got all the lab you would person who would come in constantly. He was a drug seeker. You'll get a lot of those. And he literally brought us in a cup with little stones, and he told us he'd just passed those. They were kidney stones. He needed some medicine. For number one, that's a rock you got out of the parking lot.
I was gonna say, what?
Number two, you're past it, so you're not getting nothing. But I mean, there's some people in the world that will do anything. So kidney stones usually are not that big, and they're not even like, he tried to find little ones, but they're teeny weeny and they're real like a burr. Does anybody else have those things out in your yard that you walk on and get stuck on you? They're like little just spurs all
They
over.
almost look like a stick.
That's kind of what the kidney stone is. It's very hard, but it has all these little hooks and stickers on it. So yeah, it's not smooth. Otherwise, it wouldn't hurt as it was going out. Don't be fooled by a parking lot rock. Okay? Yeah.
Okay, so what else do they call renal calculi? Because I feel like I've been seeing it.
There is another word for it, and I think I already know what it is. I know what you're talking about now. My brain's not working either.
It's okay, we'll come back to it.
Kidney stone. Kidney stone, calculi, we'll get to it. Okay, hydronephrosis, we kind of talked about that. That's where you got that in your tubes, they're blocked by a stone or something, and it backs the urine up and the kidneys start swelling. That's what that is, water on the kidney. Dull, flank pain, might be stabbing. It's on page 1695. Okay. You get a kidney stone in there, a tumor, some kind of genetic thing, they were born with it, and it's built up. The urine can't get out, so now it's backing up and it's causing pain in the kidney. Urolithiasis, is that what we're talking about, maybe? The kidney stone? Lithogenesis? Urolithiasis.
That's what my teacher says.
That's the big word for kidney stones, or calculi in the tract. Urolithiasis. We got through this too, it's all, it's what we've already had. It can, if the kidney stone's not removed or passed, you can, get hydronephrosis, which is blocking your thing. What are some of the things, nursing measures that we would do for a kidney stone? Pain, fluids. Want them to get it out. Okay, so we're going to increase their fluids. Because the more fluid, that dilates their ureters and it'll pass out. Renal tumors, we didn't go over that much. I don't think there's a whole lot about that. That's pretty self-explanatory. They're either there or not. They cause problems. Can cause obstruction. Do we get to benign prostatic hypertrophy?
No.
Prostate gland?
Wasn't that on the test? Nope, and that was on our test too.
Okay.
I'm just trying to break it down.
BPH, benign prostatic hypertrophy.
What page is that?
It's it's enlargement of the prostate gland. And what is happening is that prostate, like I said, it's kind of right there. Women don't have one, in case you didn't know. It's only a men, just in case.
Why
Never
would you
know.
have to start checking it at 50? Wouldn't you think you need to check it before?
They used to, yes, and they really should do it at 40. Because men's hormones change at 42. Especially if they're symptomatic.
Really? I think they
Depends on
change
the
every day. Sorry. It needs to be start being checked at age 50.
Hypertrophy. Do y'all know what atrophy means?
Yes, deteriorating.
Atrophy means to deteriorate. So hypertrophy or hypertrophy.
Deteriorating fast.
No.
High.
It's built up. It's too
built
much.
up. It's a lot.
Nice sparks on too high today. Loosen a little bit.
I got it.
Men in 50 or older, probably hormone change, but like you were saying, they probably need it checked sooner, to be honest. Their prostate will just enlarge and it puts pressure on that urethra in the neck of the bladder so they can't empty their bladder. Okay? And that's where you do the turtle. And I gave you that handout about. Alright? it apart, and it is awful.
There's the tuna.
Yeah. There's all kinds of ways. Now, Ashley was telling us a while back that we were talking about cloudy urine, like cloudy, C-L-O-U-D-Y, means infection, right? You see cloudy urine. And she said there's a coude. I know that I saw that somewhere. Does anybody know? That's what she was saying. Does anybody know what that is? It's a catheter that we use for BPH. It kind of has like a hook or a way around it when you're trying to before you do the prostate TURP. They can get in there, and it has like a stronger, almost like a wire in it. Yeah, and it goes through and around that enlarged prostate. So that's what it is. It's called a coude. So Nana Boo Boo, she was right, sort of. Okay. You're welcome, Ashley.
Still wrong.
She's so mad about it. She's still just a little bitter.
Yes, I heard. You supposed to say I was right too then.
You were kind of right, both of you.
You said kind of.
Y'all both
Cloud
right.
days.
Alright, so anyway, remember that cloudy urine means white blood cells are infected. What does dark urine mean? Dehydrated. Or if it's bright orange, that's freedom, and if it's cola colored or smoky, that's blood. What does oliguric mean? This was on your phase. This is the term you need to know for tomorrow, probably.
It's decreased urine output.
If you don't know, look it up real quick.
You're not putting out enough.
It's decreased urinary output. Something's not working, the kidney is not making urine, okay? It's in the, like, renal failure.
We had that today.
100 to 5. I know we need to have our lecture, then do that.
I have a question.
That would
On
really
the
help.
30 milliliters of output, right?
Right? 30 milliliters an hour is
So was the
minimal.
answer on that question 20 milliliters?
It said 20. That was the answer.
So that was the right answer?
20 to 30,
That's what
yeah.
they said, but I mean in the book it said 30.
Yeah.
So was the right answer 20?
Yes.
So 30, was 30 a choice too?
It was 20.
So if 30 is what you know, because this happened last week, if 30 is what you know, but it's not a choice, go with the one that's closest to it.
Do you think we can get that much thrown out?
So 20 to 30 is the minimal urine output you want. That's what, if they get below that, you're supposed to be making a phone call to the doctor and say, hey, they're going in a renal failure, they're not getting out of the urine. Right? So when they have polyuria, they're down to like 100 an hour.
Where do you see 30 in the book?
I don't see no rationale. It's always there. Hey, Miss. They said it's already doing the same one. He just been honest. Don't jump on me. I'm just telling you what they said. Miss, next week can we take their test because I would like to see my rationales as well.
I'm going to ask about that. Somebody else was saying that.
I would like to know why I'm getting it instead of just doing the book because Miss.
YouTube right now.
Okay.
Oh, we have
What's some of the other stuff we do besides, we're going to check the urine, creatinine with kidneys. What else do we watch for with anybody that's got kidney issues? What is a nursing measure? Strict eye node. Always. That should be right up there with your, they got kidney infection. I'm worried about them not putting out urine, so they're going to blow it up and they're going to retain fluid. So you need to watch strict eye node. You need to know that. It's the number one nursing intervention for renal failure patients, okay? Do we want high salt or low salt? Because water follows salt. What if they want salt and you have to, they say, no, I want that salt substitute. Yes, you don't want to give them salt substitutes because it has a lot of potassium in it, so you can give them lemon juice. This is in your reading, but you might come across later. Okay? Maybe. So it could be lemon juice. Okay?
Okay, lemon juice for a salt substitute?
Yes. It just gives them enough of a flavor. That prevents, you don't want to give them salt because they're going to hold on to water that well. If they're still thirsty, you can offer them hard candy. Alright? We haven't talked about dialysis yet, so you need to read up about that tonight.
Cola colored was the blood, right?
Cola's blood.
Dark.
I don't know where we're going with this. What are y'all talking about?
For reviewing.
Okay, so we're not talking about benign anymore.
No, we're over that. We had our turf, then we're doing our irrigation.
So we're just going back to
We're going back for tomorrow. Hey, I can't even help us if we're out.
We also talk about PSA, the
Yes,
test.
prostate. Prostate. PSA, do y'all know what that was? Is that on your test?
It was on the test. It was on the
PSA
test.
is a blood test to check the prostate level. What page is that on, Sam? 1704. The prostate level. See what the prostate's doing. If it's elevated, wait, I'm looking for it on this page. Hold on. I'm looking for the word. Yeah, 0 to 4 is the normal range. Okay? If it's high or elevated PSAs, mean further tests need to be done, okay? But remember I said that they'll do a digital exam. Remember how men get examined?
Oh, it
It's
is.
not the lithotomy physician, like we have to go in.
I think
They have to bend over and cough, and they get examined. Or then, and that along, if it's spongy and elastic, they're like, okay, but if it's boggy and soft and their PSA blood work is high, then they're going to do some more tests because more than likely they've got an enlarged prostate. Okay? Remember what it is? They can do this blood work, or they can do the rectal. And so it was asking which one you do first?
Yes.
What was their answer?
the digital was on the
PSA
first.
the digital first, right? And then the rectal, right?
You did the,
CSA first, the lab work.
Do the lab first, because if it's not high,
Well, it said
it's
that.
not as invasive either.
he said fucking out.
You don't want to do that unless you have to do that.
Yeah.
Okay, but I thought the answer was the digital one. It was digital, right?
It was you do that test before the digital exam.
Yeah.
You do the PSA, which is this blood work. Is that what you're saying? They said draw the blood work first?
Yeah, because if you did anything, it said it was giving a false positive.
Because one or the other doesn't really reflect, but if they get both of them, then they're like, okay, we need to go on.
You shouldn't be giving them a rectal if they don't even need it.
Well, they get it. 40 plus. That's how they examine them. It's like we have to go and get examined.
What did you say it's called? Whenever you haven't been over and coughing, if it's wet?
If it's spongy, and it rebounds real easy, then that's okay, it's healthy. But if it's soft and boggy,
Oh, that's what I was telling my husband, what y'all stop.
don't tell him.
I'm just saying if he makes me mad.
Okay.
I don't even know what's
Put
going
it
on.
in
with
your
prostate.
pocket, use it for later. Alright. So, PSA, prostate. If it's elevated, was it 0 to 4? If it's over 4, along with the digital exam, they're going to have to go get some more testing done, okay? So know that.
Okay, show us different.
Do y'all know what a cystoscope is?
No, ma'am.
Alright, let's look at it. Tell me what cysts. That's bladder. This is for, like, if you have blockage. This is like, how they'll do a rectal scope. This one goes up through the bladder. And it's just to check to see if you have blockage or not. If it's
Is
not
that
a
in the
stone.
book?
Cystoscope or cystoscopy. And that would be any time you do any kind of invasive procedure, you're going to expect blood, a little bit of trauma from just going in and messing around. So they might have painful urine or difficulty urinating after that. Because they're taking a scope and they're going up through the urinary tract, okay? It's going to be inflamed and swollen, all that. We talked about kidney stones. We want to make sure we're pushing fluids. Flush out anything that's in there. Bladder spasms, we talked about that. Do you know what medicine, we're talking about pharmacology, since y'all have had a lot of that on your HCI, what medicine would you give if they're having bladder spasms?
Something to control the stuff.
So smart.
Antispasmodic.
Yes. Okay, is the bladder striated muscle or smooth muscle? Smooth. So you give a smooth muscle relaxer like an opioid, like belladonna or opium. And they can give a B&O, it's a belladonna and opium suppository.
You know what's terrible is that we did 5 drug cards our whole life at Vista. 5. And we have anything else.
That's why y'all are struggling on that.
Yeah. Literally 5. And they quizzed us and we're like, okay, you're done.
And then Miss Wilson gave him. Shout out to her.
So if your patients have a bladder spasm, so we know we're going to clamp off at how much? 800, because no more than 1,000, and they're still having bladder spasms, you can give them a B&O suppository, which is a belladonna and opiate suppository. And that helps that smooth muscle in the bladder relax. B&O suppository. B&O. It's a belladonna and opiate suppository.
And it'll
Smooth out those smooth muscles, they don't spasm anymore on the bladder. Y'all know what the Glasgow coma scale is? Y'all remember that from neuro?
I don't remember that, but that was on the
Y'all been
test.
for a year.
I remember it, but I don't know.
Alright, so we need to know our Glasgow coma scale by tomorrow. Just letting y'all know. Glasgow coma scale.
That was on our test. It said somebody with a level.
Okay,
so it's 3. It's 3 high.
Yes.
3 being the
Find it in our book real quick. So let's look at what page it's on.
It's something about 3 said that they were. The person was it said 1.
Yeah. Have y'all ever heard the different colors that you're supposed to put on their band?
That's an ATL. Yeah. What's the one that answered? Green and yellow. Green and yellow. I went to.
I read about this last night.
I should have thought green and yellow.
I didn't know it was crazy. I didn't know black was it. I'm emerging. I'm a reader.
Listen, when that fairy comes, nursery rhymes, everybody.
What page was it?
So it was, so what was the question? It asked you if you had unresponsive patient?
It says the patient is just had some kind of head injury and they got a Gallimo coma scale of 3. I mean, I'm trying to help you. I can't speak the way you want me to. Just listen. They had a Glasgow. How do you say that word? They had that of 3, and then you had. Can they open their eyes occasionally? Follow commands. Or are they completely unresponsive? I think.
No, it said unresponsive to pain, right?
Yes, pain.
And it was
So look on page 1903, and there's a box.
it's a lot though.
You need to say this for tomorrow. Just saying.
It's in your
Yeah, it's in ATI, and then it's in our textbook, and you can always Google it. So the book says the lowest you can get is 3, the lowest score if you're not, if you're neuro impaired.
Yeah.
The highest score would be 15, meaning if you score 15 or better, you're okay neuro-wise. So he had a level of 3.
And it said he's unresponsive to pain.
Because these comatose is what it does do.
Yeah.
I don't know he's cutting out, but I knew.
So you just have to know 3 to 15, right? Is what you're getting. No, 3 is bad, 15 and more is better.
It doesn't give you your rationale.
No, and that's not fair. So
Well, the reason why it's in we're talking about in your kidneys is because if you go into kidney failure, all those toxins are building up in your bloodstream. Remember what I said a while ago? It's like a big poison, and it changes your level of consciousness. So that needs to be, make sure you know that.
can you make sure that you do ask them about why everybody else is still rational? That's not fair. We don't know why he was somebody else.
It's on that.
Yeah, and then will he show us what our problem
aren't working, and we're talking about kidneys, then that's going to throw you into that different kind of level of consciousness because you're being poisoned. Your kidneys are not getting rid of that, and that builds up, and it alters your neurons.
I wish we could do that though, do lecture before and then do the test, because that's crazy how you go right here.
It's crazy how many questions you already answered.
That's for real. Then
I
BPA
wonder if they said it in that way.
I don't know. I'll ask
Because it seemed like
that's like every week. It's been really consistent. So I'll ask her.
well, you know what that means? How we start reading class like we're supposed to.
we read.
Anybody know what an EEG is before we have to go? I'm trying to review for y'all a little bit. EEG, not an EKG, that's the heart. Okay? EEG is the electroencephalogram, assessment in the head. And the prep for that, like seizure, if you're having seizures and stuff, again, we're talking about seizures with kidneys because if you have kidney failure, you're going to be poisoned, and then that can cause an altered level of consciousness, a lower Glasgow scale, or seizures. So an EEG is a test that they'll do to see if you're in kidney failure, where you're at, where your neuro's at. And so the prep for that, you have to stay awake the whole night before. Because you're going to put those leads all over on you, and then you sleep, and they watch your brain activity while you're sleeping.
What was the one about the CAT scan?
Wash their hair that morning because we don't want it oily because then our little leads will stick. Okay? And then you, it takes a long time. You're not going to be in another like blood work drawing. It is a long hours of process of tests because you're literally asleep and they're watching your brain activity while you sleep. So don't tell your patient. They come and say, "What do I need to do for that?" Well, you need to stay up all night because you're going to sleep for hours during the test.
Are you allowed to like drink stuff?
I don't think you have to be NPO for that. Yeah, you don't have to be NPO because you're not taking meds and you're not going to be sedated. You're literally just sleeping. That's why you stay up all night.
You're not NPO.
Caffeine you probably wouldn't want because that's going to keep you up and alter your brain activity for this test. So you would tell them that. You would tell them to wash their hair that morning. Okay? And when it's done, it's done. You go back to your regular activity. So you need to know that. Anybody know what triggers for seizures are? Some triggers. Anybody know anybody with seizures? Stress, bright flashing lights. Maybe like a bunch of alcohol real fast. That can throw them into a seizure. Excessive fatigue. Like they've been like a lot of they see that a lot with soldiers that have gone 3 or 4 days without sleep. They'll just start having seizures. So because the brain just has to say, I gotta stop. I gotta shut down.
Is that on? Is that somewhere in the books?
It's in the end of our chapter. It's all the new material that we haven't gone over yet for tomorrow. But we're having our reading quiz in the morning, right?
Yes,
So that's why we're talking
Over
about.
pages, what do you have, 1707 to 1716, right?
Hold on.
The reading quiz tomorrow is going to be over. Hang on. Pages 1707 through 1716, and that's kind of what we're talking about now. We haven't gotten to our new stuff because y'all want to do the math.
Let us have it take home.
Yes, you were listening and said you were working on that.
Alright, so seizure protocols. Anybody ever had a patient with a seizure or know somebody in your family?
Yeah.
What is the first thing you do? Turn them on their side. Very good. First thing, why? Why do I care if they're on their side or on their back? Aspiration rest. Very good. Always put them on their side. Left is good, but either one is fine. Whatever you can get them to on their side. And you start timing it. Why is the time important? Exactly. The doctor's going to know first thing, how long have they been having a seizure. You've got to know the time, okay? Because that depends on how severe it was. If it's a couple of seconds and it's 2 minutes or more, you're getting into trouble. So you need to know the time, okay? When they come out of their seizure, are you supposed to get them up, walk around?
No, because they're going to be confused. They're going to have to reorient.
Right, good. You reorient, keep them calm. If they try to get up, you say, no, stay down. You had a seizure, but you're okay. Help's on the way, and you keep them there, okay? What's that called when they go, after they kind of wake up and they realize, and then they're like, okay, then they fall back asleep. Do y'all know what that's called? Post-ictal. Post-ictal phase. I think that's how you spell it. Maybe it's A-L. No, A-L, sorry. Post-ictal. that is where that sleepy phase after a seizure. They go into a deep, deep sleep, they're confused, and they will just snore. They go deep, deep sleep. And your job as a nurse, and they're in that, they're still laying on their side, because they could still throw up or aspirate, because they're so unconscious that their breathing, they may not remember to swallow. And so you keep them on their side, and you monitor their respiration, okay?
Chelsea had bad seizures. She bit her tongue like 3 times the right side.
What caused your seizure?
Post pregnancy. She called me and said, I don't know where I am or what I'm doing.
Did you have an aura? Like, you know what an aura is? Have you ever heard that? Yes. Now, they'll say people that have seizures a lot, they'll say they felt it coming on or they saw something. That's an aura. Or you've had that feeling you're about to have a seizure. Or you see like everything looks like rainbows or lights or something.
I didn't know. I just started calling people to like help me.
So if your patient said, I feel like I'm about to have a seizure, do you just let them have it right there?
No.
You try to get them to privacy if you can, or get them laying down or sitting down so they don't hit their head. Right.
She had something in the blood.
Oh, I know what y'all need to know. Kidney stones. Do I cath them? No. Why not? Thank you. Hey, you don't want to push more of an obstruction in there. You do not cath, and what do you do to their feet? Strain it. You always strain it in the little colander because you're looking for that stone. That's the parking lot rock. Increase their fluid, strain their urine. Know that. So I had glomerulonephritis, which is the kidneys are swollen up and infected, remember? I'm going to have puffiness, right? Because, why? Facial puffiness, edema. Why am I having edema? My kidneys aren't working and I'm getting rid of it, so I'm going to be puffy. I'm not going to be hungry because my body says I don't need anything else. You got enough in me. Leave me alone. So you don't want to eat. And you're going to get up a lot to pee. Okay?
On the test, I had a question talking about like if they have a stone, and it was like, what do you do? And I put increased fluids, and I got it wrong, and it said that I needed to encourage them to ambulate.
Oh, yeah. Increasing the what? Oh, yeah, you touch the water. The rationale, because it's more than one, you're right, it has the fluid with the amount of fluid they had on there was both of them are right. You need to increase it. But I did that.
Yeah, but apparently wasn't there into the mobility because that might jar it and make it.
Mine didn't say a certain amount of fluid. Mine just said increased fluid.
Mine said it's
It said 2 or something. It should be 3 or 5.
I didn't say that one to two.
What about on a dialysis patient? This is on your reading for tomorrow's new material. What do you do for a dialysis patient? A nursing measure that should always be like one of the number one things.
Check the weight.
Checking weight before and after. Because dialysis, and we'll talk about it tomorrow, that's where it takes all their blood out, cleans it, puts it all back in. That's volume. Any kind of liquid is volume. And if you're messing around with volume, you got to know their weight before and after. I know and weights. All right, for dialysis. That's a big, important lead. They have a temp. Y'all know anytime they have a high temp, report it for anything. Always do that. I think y'all will be good. Just read over those pages and kind of, we'll talk about the new stuff tomorrow, but kind of have an idea of what we've gone over just in the last few minutes. If you're not real clear on that, read it tonight. Or our test. And then tomorrow we'll finish up with this chapter and all the new materials after our quiz. Okay? Any questions? Rick, you can go. Please go. Have a good night.